The silence before a medical emergency is often the loudest sound you will ever hear. It is a terrifying silence. It is the silence of things you noticed but quickly dismissed. It is the silence of signs that happen days, even weeks, before the emergency event. We all believe we know the classic warning signs of a heart attack: crushing chest pain, numbness down the left arm, and sudden, profuse sweating. But what if I told you that, for many people over 60, especially women, those textbook symptoms are often the last warning, not the first? What if the truly life-saving signals happen when you are simply lifting a bag of groceries, or getting out of bed, or reaching for the watering can? Today, we are talking about safety. We are talking about urgency. We are revealing the 3 critical heart attack signs that are often missed, often misdiagnosed, and quite frankly, 3 signs that almost no one tells you about until it is already too late. These are the silent alarms, the subtle indicators that your heart is in distress, long before the major event hits. Knowing these 3 specific signs before an emergency changes everything. It gives you back the most precious commodity in medicine: time. We understand why you dismiss strange new feelings. We understand that after 60, every ache, every moment of shortness of breath can feel like just another part of aging. We tell ourselves, it's just arthritis. It's just the heat. I didn't sleep well. But mixing up getting older with getting sicker is the single most dangerous mistake a person over 60 can make regarding cardiac health. You need to know how to distinguish normal fatigue from cardiac fatigue. You need to distinguish simple heartburn from a critical warning. Let's start immediately with the first critical sign, one so deceptive and so pervasive that it accounts for thousands of missed diagnoses every year. This is the sign of the sudden, debilitating, and relentless exhaustion. We are not talking about being tired after a long day of gardening or after a drive to visit the grandkids. That is normal fatigue. You rest, and it goes away. We are talking about a unique, profound form of weariness that hits you out of nowhere. Imagine this. You wake up after 8 hours of good sleep. You feel refreshed, ready for the day. You start your usual routine. You pour your coffee. You pick up the newspaper. Then, perhaps 2 hours into your day, you feel a switch flip inside your body. A switch that moves you instantly from feeling energized to feeling like you have run a marathon carrying a heavy pack. Your limbs feel like lead. Your chest feels tight, not necessarily painful, but heavy, as if a weight blanket has been thrown over it. This sudden inability to perform simple daily tasks is a flashing red light. Think about lifting a gallon of milk out of the refrigerator, something you do every single day without thinking. But on this particular day, you pick it up and your arm shakes. You feel a strange, immediate strain that has nothing to do with muscular effort. It feels deeper. It feels systemic. You put the milk back down because the effort required feels monumental. You sit down immediately, thinking, I must be getting sick. This kind of rapid, unprovoked exhaustion is what doctors call cardiac fatigue. And here is the detail that no one tells you. Cardiac fatigue often affects women much more severely and frequently than men in their pre-attack phase. Women, in particular, must be hyper-aware of this fatigue signal because it is frequently the only warning they receive days or even weeks before a major event. Why does this happen? When your heart muscle is struggling, when it is not getting sufficient oxygen due to a blockage, it has to work exponentially harder to pump blood. It is constantly running a full marathon just to keep your body at rest. This massive, uncompensated effort drains your entire system immediately. It is an alarm signaling that the oxygen supply chain has been compromised. And the insidious thing about this sign is that it comes and goes. One afternoon, you might be totally incapacitated by this leaden weight. The next day, you feel perfectly fine. You might think, oh, I just had a bad night, and you forget about it. Do not forget about it. This waxing and waning of extreme fatigue is the hallmark of an unstable developing cardiac issue. The periods of intense exhaustion are your heart screaming for help when the demand on it slightly increases. If you find yourself routinely canceling plans or cutting short routine walks because you feel an inexplicable immediate need to sit down and rest, a need that borders on physical collapse, you must investigate this immediately. We are not looking for the exhaustion that makes you sleepy. We are looking for the exhaustion that makes you feel physically powerless. Now, let's move to the second critical sign that is overlooked, often because we attribute it to the most common ailment of aging: arthritis and musculoskeletal wear and tear. This is the sign that shows up far away from the center of your chest. This is the pain that doctors sometimes fail to connect to your heart, focusing instead on orthopedic solutions. We call it referred pain. This is the sharp, electrical, or achy pain that manifests in your jaw, your neck, or your upper back. Think about the structure of the nervous system. The heart does not have its own dedicated set of nerves that scream, "I am the heart and I am in trouble." Instead, the pain signals from the struggling heart muscle travel along the same nerve pathways as the signals coming from your jaw, your shoulder, and your spine. Your brain, trying to decipher where the distress signal is originating, often misreads it. It assigns the pain to the easiest location, the neck or the jaw, and that is where the danger lies. When your shoulder hurts, you rub it, take an anti-inflammatory, and assume you slept wrong, or you lifted something too heavy yesterday. But cardiac pain manifesting in these areas feels distinct. This is the crucial detail the textbooks often skip. If the pain is cardiac, it will often feel less like a muscle strain and more like an intense, spreading pressure. Let's focus first on the jaw and the neck. Imagine a sudden, deep ache that feels like a toothache on both sides of your lower jaw. It's persistent. You try to clench your teeth, you try to drink hot or cold water, but nothing changes the ache. Dentists sometimes see patients who are having a heart attack because the patient is absolutely certain they have a serious dental issue. Yet the dentist finds nothing structurally wrong with the teeth. If this jaw pain is accompanied by the slightest shortness of breath, or if it radiates up the side of your neck, it is extremely dangerous to dismiss it as dental or muscle tension. Now, consider the neck. It is not the pain of a stiff neck from working on the computer. It is a deep, suffocating tightness that runs from the base of your skull down into your collarbone. Sometimes it feels less like pain and more like a tight, high collar choking you. This sensation is especially critical when it occurs upon exertion. You might be walking the dog, and suddenly, that tight collar sensation clamps down. You stop walking, the sensation eases up slightly, and you proceed, thinking the tightness was a momentary muscle spasm. But the moment the heart is forced to pump harder, the pain signal flares. The moment the heart rests, the pain subsides. This correlation between effort and neck-jaw pain is a direct warning signal. And finally, the back pain manifestation of this second critical sign. If you experience unexplained, radiating pain in your upper back, between your shoulder blades, This is one of the most frequently missed cardiac symptoms in older adults, particularly those who already suffer from chronic back pain. The cardiac back pain feels different from muscle stiffness. It is often described as pressure, a heavy ache, or a constant dull throb that refuses to be relieved by changing position. It is less likely to be relieved by stretching or heat. It feels structural, persistent, and deep inside the rib cage, radiating backward. If this upper back pressure is accompanied by that inexplicable, profound fatigue we just discussed, you have two serious, silent alarms ringing simultaneously. This requires immediate medical attention. The goal here is not to make you paranoid about every minor ache, but to train your mind to identify the specific unusual characteristics of these pains, their depth, their location away from the center of the chest, and their connection to sudden, severe fatigue. These two signs, the debilitating, unprovoked fatigue, and the deep, persistent pain in the jaw, neck, or upper back, are the quiet language your heart uses to ask for help, long before it sends the catastrophic chest pain signal. In the next part of this conversation, we will examine the third critical sign. This one is perhaps the most deceptive of all, because it is so easily confused with a common digestive problem. We will discuss the reality of silent, recurring stomach distress that is actually a cardiac emergency hiding in plain sight. We will detail exactly how to tell the difference between ordinary indigestion and a life-threatening heart signal, and what action you must take immediately when you recognize this final critical warning sign. Please make sure you join us for the final part of this vital safety guide. Your continued awareness could truly save your life. We left off discussing why relying on the classic movie heart attack scene, clutching the chest and falling over, is a deadly mistake. For those of us over 60, especially women, the warning signs are silent. They are confusing. They are often dismissed as just getting older. These are the three critical signs no one typically tells you about before an emergency strikes. Learn these now. Critical sign 1. The invisible, unexplained exhaustion. This is not the fatigue you feel after a long day of gardening or chasing the grandkids. This is a specific, overwhelming exhaustion that strikes quickly and without reason. It feels like your battery just drained from 100% to 0 in 5 minutes. It's the exhaustion that makes simple tasks feel like wading through wet cement. Think about your usual routine. Do you walk your dog 3 blocks every morning? Can you normally carry 2 bags of groceries from the car to the kitchen? If you suddenly find yourself unable to complete half that distance, or if those 2 grocery bags feel impossibly heavy, pay attention. This is a critical warning. The heart, when struggling, cannot pump blood efficiently enough to supply oxygen to the rest of the body. The primary symptom of this oxygen deprivation is profound, sudden fatigue. This exhaustion often presents alongside breathlessness. You might find yourself pausing repeatedly just to breathe while talking on the phone. You might need to sit down after climbing just 1 flight of stairs, even if you could easily manage 2 flights last month. We, as seniors, are conditioned to minimize symptoms. We tell ourselves, I must have slept poorly, or I overdid it yesterday. Stop that thought immediately. If the extreme exhaustion is new, and if it doesn't resolve completely after a night's rest, you must treat it as a cardiac event until proven otherwise. This specific type of fatigue may also appear intermittently. You might feel terrible Monday, fine Tuesday, and completely exhausted again Wednesday. This stop-start nature makes it easy to rationalize away. Do not rationalize it. Think of the laundry day test. You normally handle 3 loads of laundry without issue. But today, halfway through folding the towels, you feel so dizzy and worn out that you have to lie down. This is abnormal. This is the heart asking for help. When this fatigue strikes, your recovery time is key. If you sit down for 10 minutes and feel 80% better, that might be simple exertion. But if you sit down for 30 minutes and still feel utterly depleted, you are facing a medical crisis. Do not wait for it to pass. Do not assume it's the flu. This silent, inexplicable fatigue is one of the most critical red flags ignored by seniors globally. Critical sign 2. The mysterious stomach distress. When the heart is under severe stress, it triggers nerves that communicate with the central nervous system. These nerves often map back to the stomach and digestive tract. This confusion means that a heart attack can masquerade perfectly as severe indigestion, heartburn, or even a bad bout of gas. If you experience persistent nausea, severe stomach pain that is high in the abdomen, or burning that feels exactly like acid reflux, this sign is for you. Why is this so dangerous? Because almost everyone over 60 carries antacids. We have Tums in the purse, Pepsid in the medicine cabinet. We default to self-treating stomach issues. The critical difference is this. If you are having simple indigestion, an antacid will usually provide relief within 15 or 20 minutes. If you are experiencing a cardiac event, the antacid will do nothing. The discomfort will persist, or it will worsen. The pain often settles right under the sternum, making it indistinguishable from severe GERD. You might feel bloated or experience a deep, unsettling pressure in the stomach region. This sign is especially common in women, who are less likely to experience the classic chest pain. They describe the feeling as overwhelming nausea, sometimes leading to vomiting, often accompanied by cold sweats. Imagine you just finished a normal, healthy dinner. An hour later, you feel deep, unrelenting pressure in your upper stomach. You take an antacid. 30 minutes pass. The pressure is still there. Your stomach feels heavy, almost paralyzed, and the nausea is getting worse. This is the moment the internal alarm must go off. Do not wait another minute for the antacid to kick in. If standard relief measures fail, you must assume the worst. Many seniors dismiss this as a reaction to a new vitamin, something they ate, or simply age-related slow digestion. This is a fatal assumption. Another form of this stomach distress is generalized anxiety linked to the abdomen. You might feel a profound sense of doom, coupled with stomach cramping, but without typical diarrhea or bowel issues. This overwhelming physical anxiety, if sudden and unexplained, is another crucial indicator that your heart is struggling. The rule of thumb for sign 2 is clear. If stomach discomfort is accompanied by unexplained cold sweats, lightheadedness, or failure of standard antacids, you must call for emergency help. Your digestive tract is signaling a heart problem. Critical sign 3. The silent, migrating pain. We are taught that pain from a heart attack stays in the chest or radiates down the left arm. This is true for many, but not all. The third critical sign that nobody emphasizes enough is the pain that appears nowhere near the center of the chest. It settles silently in areas you'd normally attribute to muscle stress or arthritis. The heart sends warning signals through specific neural pathways. Sometimes these signals skip the chest entirely and land in the jaw, the neck, or the high back between the shoulder blades. Location: A. Jaw and neck. A heart attack can feel exactly like a severe toothache, sometimes only in the lower jaw on one side. It can be a deep, aching discomfort that you might initially attribute to a dental issue or temporomandibular joint, TMJ problems. If the jaw pain feels heavy, compressive, or does not respond to common pain relievers like Tylenol or ibuprofen, you must immediately suspect a cardiac cause. Similarly, the pain can settle in the neck. It feels like a severe stiffness or pressure that runs up one side of your throat or the back of your neck. It's often mistaken for sleeping wrong or chronic cervical spine issues. The telltale difference here is its quality. It's often described as choking, heavy, or squeezing, rather than sharp or positional, like a crick in the neck. If you move your head around and the pain does not change or improve, the source is likely deeper than the muscle. Location B. High back and shoulder blades. This is perhaps the most deceptive sign, especially for women. The pain settles silently between the shoulder blades, sometimes described as a crushing weight or persistent, deep ache. How often have you felt tension between your shoulder blades after a long day sitting? We assume it's poor posture or stress. But if the ache is new, if it's unrelenting, and if it is not relieved by stretching, adjusting posture, or a heating pad, it could be referred pain from the heart. This high back pain is particularly concerning because it allows the cardiac event to progress completely undetected. We dismiss it as muscular until it's too late. If you feel sudden, heavy, non-positional pain radiating across your upper back, from the left shoulder blade straight across to the right, you must act immediately. Do not massage it. Do not ignore it. The danger of this migrating pain is that it is often only the symptom. You might have the back pain, but no chest discomfort, no arm tingling, and no shortness of breath yet. This is your exclusive early warning. The critical overlap. Recognizing the cluster. Very rarely will a life-threatening event present with only one of these silent signs. The truly dangerous moment comes when you experience a combination of two or three. This is called symptom clustering, and it dramatically increases the urgency. If you feel unexplained nausea, sign 2, and sudden jaw pressure, sign 3, you are in a crisis situation. If you experience extreme exhaustion, sign 1, and that deep, unrelenting backache, sign 3, you need immediate medical intervention. You are the first line of defense. Your ability to connect these vague symptoms to a critical underlying issue is what will save your life. Do not let the medical literature's focus on textbook symptoms distract you from your body's true, unique warnings. Action plan. The immediate response. Now that you recognize these 3 critical unspoken signs, what do you do the moment one or a cluster appears? Your response must be immediate, clear, and focused. Do not hesitate. Step 1. Stop and sit down. The moment you feel any of these signs, especially the overwhelming fatigue or the sharp, persistent pressure, stop all activity. Sit or lie down immediately. Movement increases the heart's demand for oxygen, which is exactly what it is struggling to supply. Step 2. Call emergency services, 911, in the US, Canada. Do not call a neighbor. Do not call your spouse at work and ask them to drive home. Do not attempt to drive yourself to the urgent care center or the hospital. The ambulance crew brings life-saving equipment and medication right to your door. They can begin treatment the second they arrive, which is precious time saved. When you call, state clearly that you suspect a heart issue due to unusual symptoms, such as unexplained fatigue and nausea, even if you don't have chest pain. Step 3. Take aspirin, if medically safe. If you are not allergic to aspirin, and if you have not been told by your doctor to avoid it due to a bleeding disorder, chew 1 full-strength, non-coated aspirin 325 milliliters. Chewing the aspirin allows it to enter the bloodstream faster. Aspirin is a blood thinner. It works immediately to reduce clotting and help keep the artery open until professional help arrives. Do not swallow it whole. Chew it thoroughly. Step 4. Stay calm and monitor. While waiting for help, focus on deep, slow breathing. Do not panic. You have identified the problem and you have taken action. This is the best possible outcome under the circumstances. The final urgency. We spent this time focusing on the signs that are easy to dismiss, the ones that feel like minor annoyances. But they are the most dangerous, precisely because they lull you into a false sense of security. Remember, heart disease doesn't always deliver a dramatic, theatrical punch. Sometimes it knocks softly on the door in the form of deep fatigue, a nagging stomachache, or a stiff jaw. You now possess this life-saving, exclusive knowledge. Do not keep it to yourself. Discuss these 3 critical signs with your family and friends immediately. Knowing these signs is only half the battle. The other half is being prepared for the moment they strike. In our next segment, we will shift focus from recognizing the signs to the vital steps of complete preparedness. We will cover how to build your emergency information kit, what medical details must be posted prominently in your home, and the single most important conversation you must have with your pharmacist today. Stay with us. Your preparedness is your greatest strength.